Hi, Anna. So lovely to have you here. Welcome to Black Women's Health Futures podcast.
Thanks, Chuke-Okafor. Brilliant to be here.
Fab. So before we dive in, I'd like to start with you. Yeah. So can you introduce yourself and tell us a little bit about your journey and the work you're doing with Future FemHealth?
Absolutely. So I'm Anna O'Sullivan. I'm the founder of Future FemHealth, which is a media and intelligence platform dedicated to the women's health industry. I've been running that for 3 years now. And I'm also the co-founder of Censorship, which is an advocacy campaign and initiative where we tackle the ongoing censorship and suppression of women's health content online, particularly on social media platforms. And to take a step back from both of those things, my background's in PR, communications and journalism, and I've worked in the corporate world for around 20 years, and I'd worked in a number of different industries, not women's health, but I'd worked in the NHS. And I was very fortunate in those industries they were very well established and mature, and you'd be reading about education and finance, of course, in mainstream media the whole time, and without any kind of taboo or stigma around those topics. And that's what kind of really interested me about women's health is it's this area of our health which is so important to half the planet, and yet it's rarely, a lot of the topics are rarely seen in mainstream media. And when they are, there's a lot of embarrassment and shame around using the proper terms around the women's body. And so how can we progress that forward if we can't have those conversations, and where is that spotlight coming through? Alongside that, I was going through my own personal health journeys like so many people do when they come into women's health. So I'd experienced fertility challenges, and my mum was diagnosed with womb cancer as well. And I guess I was at this point where I was in my mid-30s really learning so much about women's health for the first time, and realizing how little I knew about my own health and the health of those around me. And then also how little the healthcare system actually knew about our health, and how many questions remained unanswered. And I was learning about the gender health gap for the first time, and I was coming across this term Femtech for the first time. And, I just thought to myself, how can I be at this age where this is the first I'm hearing about it? And that sort of curiosity started off with Future FemHealth as essentially a weekly newsletter, much like your podcast project, to be honest, where you're kind of following your curiosity, speaking to interesting people, learning about what's happening in the space and documenting it. And over the past 3 years, that's really grown. So we now reach 100,000 readers each month across the weekly newsletter, but
That's
also the
amazing.
website, thank you, and social platforms. And it's much more than, a news roundup, for example. It's about explaining what's happening, but also why it's happening, why it matters, and what the future of women's health is going to look like. So I look at, the money that's coming into the sector, the new partnerships that are happening, what regulatory approvals are happening, and how does that move things forward? How does what's happening in politics and government impact the future of women's health? So sort of looking at it really in the round, so that anyone working in the space can really understand it better and make better decisions at work. And then on censorship, that was a chance meeting over lunch with my co-founder, who had experienced this censorship of her content online, where simply for posting a picture of herself in a bikini as a body positivity image, that got perceived as inappropriately nude content, adult content, and was taken down. And I was also hearing this from the founders that I speak to in women's health, that often when you try to speak about periods, menopause, vaginal health, female cancers, etc., that content is removed because it's miscategorized by the algorithms as inappropriate. And I'm sure we can go much more into this when we talk about the AI later on as well. But that's where I've got to, and I'm just so pleased that over the last few years I've been able to make this my full-time roles essentially as well, moving out of that corporate space, and really feel like I'm contributing to the ecosystem globally, which is so exciting because it's such a brilliant space to be in.
That's just amazing. I mean, you hit some really good points there, Anna. And I agree with you. It just feels like we go through life too ashamed to talk about things that happened to us and started happening to us from a very young age. Now, I started seeing my period at age 9. So this quite early. And
Yeah.
so there was a lot of misinformation in my head. It was just kind of like, what did I do wrong? Oh my God, what is happening to me? Um, just because there wasn't enough education or communication at all. And once you start to see a period, the only information I got was, well, from now, if a man touches you, you'll be pregnant. Like, so I was like, oh my God, so I can't have like body contact with anybody. Like, it's just really, it's just, yeah. So I'm kind of glad that a lot of that is starting to change. And yeah, it's definitely a conversation that needs to continue. I mean, we've seen such a rise in femtech over the last few years, but a lot of solutions still feel like they're responding to problems rather than preventing them. Can you take us back to the moment Future FemHealth started addressing such areas? What problems were you trying to solve when you started it? But, do you feel like you've made progress towards how people think about solutions for femtech and for women?
Absolutely. And I think this is a really uh, important moment in time. So I think when I started Future Fem Health in 2023, it was very much that the whole industry was having to make the case for women's health and why it mattered and why it shouldn't be treated as a niche and why it needed investment. And that's what was reflected in my newsletter. Essentially, it was rounding up news of all these reports that were making the case for what women's health could be. And you're absolutely right. In products, a lot of the products out there and still are there filling the gaps of the healthcare system. So they're faster diagnostics, or their wraparound care support, or their educational products, because you're not getting that from your traditional healthcare systems. What we have seen positively over the past few years, and particularly in the last year, is a real shift, I believe, where women's health is getting taken more seriously. So that's been contributed to by everyone in the industry, whether you're building as a founder or whether you're part of the ecosystem, doing the research and sharing the insights. But we now know that women's health has already seen $100 billion worth of exits in its time, which shows that it is not just a niche, and it is a success story already. We know that the women's health market is expected to reach 600 billion in market size by 2030. If we do invest, we can contribute 1 trillion to the global economy every year by doing this as well. And so we know that it's successful. And what I'm hearing more and more of is investors sharing how their portfolios are performing well, and women's health is an outperformer within the portfolio. So over time, that momentum sort of feeds itself, whereas women's health doesn't become the risky area to invest in, but actually should be a safe bet. And the data just keeps coming through. This week we've just had a huge buyout of Organon, one of the world's only and largest women's health pharma companies, showing that, big pharma wants to invest in this space and build it out. We've had more unicorns, which means that, companies that are hugely scaling in women's health, like Maven in the US, Flow Health in the UK. So we're seeing those success stories. There's a lot to do, of course, but as an industry, it's moving in the right direction.
Now that's really great to hear, and I can see that. I think it's the message is becoming louder. It needs to get louder, but it's definitely, I can hear it from where I am. So that's really a good thing. I mean, when you look at the system as a whole, there are still so many gaps. Women's pain being dismissed, long delays in diagnosis. Where do you think health systems are still failing women, the most?
Well, all of that. I mean, where isn't I mean, so, in the last week, we've had the refresh of the Women's Health Strategy from the UK government for England. And when I look at that refresh of the strategy, very little in there is about progressing women's health. Actually, what's in there is about bringing up to what should be a fundamental baseline expectation of a functioning healthcare system. Really, I mean, the central message from the health secretary was that we need to end the gaslighting of women and the misogynistic culture within the NHS. That's not progress. That's, what we should expect every day is that our voices are heard and that we are not dismissed. So, there is so much to catch up on. We need overinvestment in the space in order to do that, to fill the fact that the research gap is so broad after, women were not included in clinical trials until 1993. So you've got many of your listeners and you'll be aware of many of these statistics, but we need that overinvestment to level the playing field for women's health. And of course, when you then look into segments of health as well, so what's happening in maternal health, especially for Black women in childbirth and postnatally and during pregnancy as well. Again, there's specific areas that really need focus, and it's failing women on a level that cannot be acceptable. And actually, in some areas, the statistics are showing that things are going backwards. Maternal deaths, I believe, are now at a 20-year high. So really, there's so much to do, but it falls into those areas you referenced at the start. The dismissal of women's voices, that late diagnosis and the reactiveness of the care, and the way that there is still so much inequity in the system.
That's right. And I think part of the challenge is that there are still so many myths around women's health. What's normal, what should be tolerated, just a lot of misconceptions. What are some of these misconceptions do you think are still holding women back today?
I think one of the biggest misconceptions is that women's health is just reproductive health. And so when you talk about investment in women's health, people think that it means investing in, reproductive health. And so I can see how people might feel that it feels like it's swaying too much towards, a biased investment in that way. But actually, when you look at all areas of health and how they impact women differently and disproportionately. So we know that, 80% of autoimmune patients are women. Migraine sufferers, again, about 80%. Alzheimer's, much more prevalent among women. So we need investment into all of these areas, but specifically looking at them for women so that we can solve for women rather than coming up with solutions that are one size fits all, but don't actually solve the end goal. I think another misconception is that obviously women have traditionally sort of a longer lifespan than men. And so again, you think, well, women live longer than men, so that's okay. But of course, we now know from the well-known reports that women live more of their lifespan in ill health, around 25% more than men. And actually, a lot of that is during their working life. It's earlier in their life. It's not just at the end of life when you're in your 80s or 70s. It's actually in your 20s and 30s when it's period pain or pregnancy challenges or all number of experiences that you're going through. So I think that's quite a big misconception. But again, there's so many. And I think what doesn't help it, which I referenced at the start, is the taboo, the stigma and the silence around women's health, which means that because we're not having those open conversations, we can't break down the misconceptions. And, that's at a very individual level, isn't it? And we were talking before about it starts in school. So if you've got a teacher that is too embarrassed to talk to the class about periods and fertility and talk to the whole class, not just girls, but boys as well, and talk really openly, then the whole class becomes embarrassed about that.
That's
There's a
right.
lack of understanding. Children are not going home talking to their parents about things. Parents have been brought up a generation before where these conversations were not happening. And then the whole cycle begins again, and you have, women growing up that don't understand that, you may start your period early, you may start your period late, you may have heavy periods. What is a heavy period? When do you need to get it investigated, looked at, and all of these sorts of things that can happen during our teenage years and adulthood.
That's right. And, I think you touched on a lot of things there. One of the heaviest misconceptions I know is that women are expected to multitask, like they have a billion and one hands, working, you're expected to work full time, but also manage everything about the home and all of the worries around childcare, etc., and food on the table. I think it definitely starts to take its toll one way or the other. And so that's a lot of education that needs to change because I think a lot of women in my generation we're trained to believe that we can do it all, and so it took a lot of
Yeah.
pushback to say actually no I can't. But even at that, to an extent, you still are, So yeah, there's a lot of work to be done around that. Yeah,
And often the healthcare systems are not designed around that as well. They don't recognise that women have all of these things that they're juggling each day. So you go for an appointment that's, you spend an hour on the phone trying to make, and then, you've got a long wait and an appointment time that's not of your choosing. It's whatever you can get, and then you're having to juggle childcare or getting out of work, or not seeing an aging parent that day, and then you're probably going to see 2 or 3 different providers to get your blood test, have the consultation, have a follow-up. And so we're not really designing around women's lives, and that's what was really promising about the women's health hubs in the women's health strategy originally, was this one-stop shop idea. And so, more of that integrated care is so important that we need to be thinking about when we design anything for women. It's not just what their physical health need is, but what's going on emotionally,
that's right.
at home, everything else that you need to build into whatever you're creating.
That's right. And to pile on top of that, from if I talk from a Black woman point of view, as a cultural nuance as well, that coats all of that. Because at the end of the day, women are all different. And even in different ethnicities, everyone's kind of different. But sometimes we're building solutions for the woman as if it covers every single aspect of being a woman. There's a lot of excitement around AI right now, as you can imagine, especially in terms of personalizing care and early detection. How do you see AI really transforming women's health over the next few years?
So it has so much potential to do that in a way that we've not had the ability before, but there's also so many pitfalls, and I think we're already, seeing that on an individual level. Again, there was a report out recently that said that the large, the LLMs that we all are all using,
Mm,
60% of the answers that it's giving on health are not accurate. So already, the
mm,
ramifications of that in terms of them, the follow up or the actions that people are taking based on that information are quite stark. But on the flip side, we're seeing the application of AI in innovation being so promising, particularly across fertility, or looking at patterns in biomarkers, for example, and being able to really draw out insights that we've not been able to do before from these perhaps large, really messy, unstructured data sets, and
mm,
give us the answers about women's health to really take things forward. So I covered Future Fertility this week, who raised a huge funding round, around $4 million, I think it was, and they're using AI for embryo quality assessment during the fertility process. So actually giving people answers much earlier in their fertility journey. Sorry, but egg assessment.
mm.
So you can start to make better decisions with your doctors at that point of what your egg quality is like and what your chances might be through the IVF process. And, the emotional turmoil that you go through when you go through IVF, if we can help to alleviate some of that earlier on, is really powerful. So that's just one example of the application of AI, but it's across, all of these things, endometriosis, PCOS, menopause. It's super exciting. But as I say, the risks there on the individual level, I think, are quite worrying. And of
Mm.
course, all of AI depends on the data sets that you're using and what you're feeding into these systems. And we know that if the clinical trial research is lagging so much behind for women, then there are such gaps in the data sets. And so it's
That's
really
right.
key that, we're
And at
not
the
just
same
repeating
time,
history.
yeah, because at the same time, these systems aren't neutral either. They reflect the data and the people behind them. And so there are risks to that. What risks around bias in digital health should we be paying closer attention to, in addition to what you were saying? Yeah.
It's already happening. And I come at this from my work at Censorship, where we look at the impact of that on the social media platform. So perhaps a different slant here, but because those social media algorithms have been built predominantly on male-led data and content through a male lens, where women's bodies are sexualized and through that lens, then when you do see a woman in a bikini, it's automatically determined that that's intended to be sexualized, when actually we know now that so much content on social media is about building a community of women among women for
Mm.
celebrating body positivity or educating on women's health. So, in another example, we had one of our case studies where they tried to post an advertisement for their diagnostic tampon, and it was featuring a pregnant woman who was showing the pregnant belly, and that was taken down for nudity and adult content. So you can see how the way that the social media platform has been built on the AI data, and also the automation that's happening using AI, is creating these bad decisions.
That's right. And even beyond AI, a lot of digital health tools are still designed with, a very narrow user in mind, like I was saying before. So what does good actually look like when we design for women properly?
It's such an important thing to be thinking out from the day one. And I guess I'll take this answer from, a Femtech startup perspective, and how, many of the founders in Femtech have come to it from lived experience. So firstly, it's about ensuring we have a range of founders in the space who bring that different lived experience, so that we can build for different audiences. And I think that's really key. And if you're not representing the audience or the consumer that you want to reach, then you need to bring people in that do have that lived experience or do have that expertise, to make sure that you're able to represent everyone. I think another component to this is that it's challenging from a funding perspective. So every day that you're building, you're making 100 decisions about the priorities of your company and what you can spend time on and what you have to deprioritize. And when you are bootstrapping or you are seeking funding, that can be tough, right? You're having to build a minimum viable product, so to speak. So
Yeah.
how can you actually build for all, but also make sure that you're not burning yourself out and making your product unsustainable? And I think this is where we have to be realistic and practical about what does that actually look like in practical terms, especially when, going back to the funding point, we know that women are getting, only 2% of VC funding, and Black women even less than 1%. So the money's not there to make this all simple, sort of throw money at the wall and make it happen, so to speak. So it's really thinking cleverly about how you do that, bringing the right people in, testing with diverse groups, using diverse data sets as best you can. And I just thought to call out there one of my favourite founders in the space, Elsa Zaken, who's building soccer data. And this is a way that enables more women to take part in clinical trials, specifically Black women, because her experience was seeing the gaps in the data sets, seeing the gaps in the clinical trial data, and wanting to help fill that. And so what she is working on is a way to enable more women to take part in the clinical trials, build those data sets, and then of course that can then fuel the innovation, fuel the outcomes, and start to build a much more virtuous circle of what's happening. And I think that infrastructure layer of what she's building really goes hand in hand then with the individual founder who's building.
Yeah. No, that's great. And because inclusion isn't just about who you include, it's also about the things that you design, who they reach, whether people trust them. What does a truly inclusive women's health platform do you think would look like for you?
I think when it comes to truly inclusive is that it's not exclusive as well. So as you speak to those areas, is knowing who you're designing for and making sure that it doesn't exclude through design where you've unintentionally designed people out of using your service. So it might be a language barrier, it might be accessibility for vision, and looking at where you best play a role in that. So example that springs to mind is pregnancy tests, that you just buy from the supermarket and you use without a thought. What a founder that was visually impaired herself was like, how do you do a pregnancy test if you're visually impaired? Like, how you shouldn't have to have someone else find out you're pregnant before you are,
That's a
which
really good one. I mean, that's one you wouldn't even think about unless you have that challenge, right?
exactly. So, it does take then a dedicated innovation like that and looking at how do we make that a sustainable product that, can be commercially viable,
Mm.
reach the right people. And I think, partnering through partnerships, but also, looking to those bigger companies that have gone before you to really support that. That's where I think innovation can really come to life as well. So it's, in reality, some products like a pregnancy test will exclude people like visually impaired. So then it's looking at how do we solve for that as quickly as possible as well.
Yeah, I think you make a really good point when you talked about the fact that as a founder, you're almost kind of always you're forced to balance that equation of trying to build for more than one view, more than one description of what perhaps a woman needs, and also try not to put yourself in a pickle, right? By overspending or yeah. So we're seeing so many startups entering this space, femtech space, which is really exciting, but also raises that question, how can finders avoid building solutions that always only work for a small group of women, for instance, without necessarily burning themselves out, like you said? What have you seen happening in this space? How are they handling it?
And that's a really key area where, especially around price and accessibility, wearables, for example, we know are really only available to the most affluent when you've got a smartwatch or a smart ring, which comes into the hundreds of pounds. And so
Mm.
actually it's saying that preventative health is only available to the few. Um, and again, I try to take a step back and look at what other route could have happened, what else could have happened there. And what's, I think, promising is that now these businesses are commercially viable, sustainable, there's can look at how do they make their product free for certain communities. Wearables were mentioned in the Women's Health Strategy Refresh, for example. There's going to be trials in communities, particularly on cardiovascular health for women, to see if that can be used for preventative health. So it's then partnering through the NHS to get those to people that would not have had access otherwise. So I think as a founder, you need to decide where that comes in your journey. If you're able to build for a specific demographic right from the start and make your pricing really work for all from the start, or whether you've got a strategy for that further on, because I do see founders that have this desire to make their product free for all right from the start. Period apps is a really prime example of this. And
Mm.
then they don't exist a year later because you can't pay yourself with thin air. And that's the harsh reality of this is really taking that sort of strategic thought about what
Mm.
works, but what delivers outcomes.
Yeah. That's so yeah, that's such a good point right there. So I wanted to, yeah, another area I wanted to touch on is I know that historically women have always leaned on each other, sharing knowledges, experiences, advice. So what role do you think community plays, and how can technology support that in a meaningful way?
So community is absolutely key because for every reason we've spoken about, if you're not getting the information about your health, your body, and that education from school, from your healthcare system, then it's your community, it's shared learnings, it's that peer support. Where it
Mhm.
really plays that role is helping women to realize they're not alone and that something isn't normal or it is normal. And so you can really understand whether you need to seek help for something or whether it's a shared experience that you can support each other through. And so I think communities are key. I've seen in women's health, the role that they play. A company I'd call out would be Jude, which is an
Mm.
incontinence product. And they have a really thriving Facebook community of around, I think, 30,000 women now, or even more. And everyone in there has that shared connection
Mhm.
of incontinence and bladder weakness. And so they're in there talking about the product and reinforcing the product, and the commercial sales of that are thriving through that community. But
Mm.
also they provide, it's that connection point that they would never have had previously, that really, it's all the tips and tricks, and it's, how do you get through your day? Who's tried this out? What about this in your diet? So it's super powerful when it works well.
Wow, that's really, yeah, insightful one. There are a number of growing number of platforms in this space, all trying to tackle different parts of the problem. You've just mentioned a really good one. Are there any other ones that come to mind, and where does future femtech fit within that, and what makes it different?
Yeah, so I see Future FemHealth as kind of that ecosystem support for women's health. So looking across everyone in the space and bringing everyone together that's working in the space to help them move faster and further ahead, because that news about women's health is dotted around. It's in some mainstream media, it's in some tech publications, it's in some health publications, but no one is bringing women's health tech and femtech together in one place and then really connecting the dots across it all in the same way that I do at Future Health, and really becoming that intelligence layer for the area. And that's where I think community is, such an interesting word, because it can be a physical community that meets offline at events and gets to know each other. It can be online community where you're in a Facebook group and you're swapping conversation, or it can be a community such as I've built through Future Fem Health, where they're sort of my community and people reply to my newsletter each week and, email each other because they've seen someone featured in the newsletter and it sparked a conversation that they want to have. And so it works in a different way, but it helps to build those real connection points between each other.
That's awesome. I mean, some of the things you've said about building in health, especially women's health, is that it's easy and straightforward. I think, from everything you've said, there are funding gaps, structural challenges. What have been some of the biggest challenges for you building in this space?
I think because it's a strange one, I'll say it's new, but obviously it's not, women's health is not new. But the women's health category, femtech as a category, it's still 10 years on since
That's right. Pretty
Edith
new.
coined the term. There's still, I think, half the startups or more have been founded in the past 5 years. It's still so new. And so creating something like Future Fem Health is brand new, and we don't have those established communities and infrastructure that we do in other sectors like education and finance that I came to before. So
Mm.
you're building something that's new in an area where you do face additional challenges around censorship and And so, if I'm trying to promote Future FemHealth on social media, I do have to be cautious about what language I might use in my content, so that content isn't suppressed by the algorithms.
Yeah.
And when it comes to, attracting sponsorships or partnerships to build Future FemHealth as well, that's not always easy when you're building the case for women's health at the same time. But again, thankfully, things are starting to change. But overall, more positives than negatives. But anyone building anything, it's always a challenge. Every day brings a new challenge.
That's right. Yeah. I mean, if we zoom out for a moment, um, the system we have today wasn't really designed with women fully in mind. Most of the systems we have. If you could redesign women's health from the ground up, um, what would that look like? Where would you even start?
Well, I think if we were able to actually redesign women's health to be fully integrated into healthcare from the start, because healthcare had been designed through a sex-based lens, that would be beneficial for everyone, women, men, all genders, because we would be treating people as the person, not through this one size fits all. So that would be my first wish. If we had the data sets to really understand physiology on the male and the female side much better, and we're applying that into healthcare much more effectively. A lot of what we talked about earlier, so having more integrated care designed around us as women, not through, be here at 2:00 on Friday or else type care that we have at the moment, and that women's voices are heard and not dismissed, so that we can get those earlier diagnoses
Yes.
and the faster care that we deserved. And, that could reduce so much burden on the healthcare system itself, but also emotionally, physically on women as well. And I think another one I'd just touch on would be that we didn't have to align incentives with outcomes. And what I mean by that is that once you dig beneath the surface on healthcare, you understand why so much doesn't happen because it's not financially viable. So I did a deep dive recently on PCOS, for example, and I realized that there's really not very much happening in the pharma world in terms of coming up with a cure for PCOS. And one of the reasons for that is that there's no incentive to do that financially, because at the moment, if you go with PCOS to your doctor, you're often just given the contraceptive pill and told that can help with your symptoms, or, the symptoms are addressed at the point that you have fertility challenges. And so there's no one that would really own that PCOS as an issue, or there's no financial viability for a expensive pharma drug to be developed when we've kind of already got a good enough solution through their eyes, not through the eyes of women.
Yeah.
And so that explains a lot of what's happening in women's health, is the sort of incentives behind the scenes. And I'd love to be able to take all of that away.
That's such a good summary of what's happening.
Yeah.
That's such a good summary where women are giving solutions that from a different perspective is sufficient, whereas it's not really. But, when they compare it with the expense of trying to get the right thing for the woman, it just feels like it doesn't make much sense. However, if you're looking at it from the patient's point of view, then that's quite different, isn't it? And
Absolutely.
it feels like what we're going through, though, it's as a pivotal point, like you've said. There's so much innovation now, but there's also a risk of widening gaps. So what excites you about the future and what concerns you?
I think widening gaps, absolutely, because so much of the innovation is built for, that now we're seeing preventative care and longevity and all of these, buzz terms coming through. A lot of that is about expensive tech or expensive, body scans or supplement protocols. And that's for the few and not for the many. And we need to see that filtering down and adopted by our healthcare system so that, this is available on the NHS for all. And we need the NHS to really open up and work with innovators more collaboratively so that we can bring the best of those solutions into the NHS and make them available for all, and have more investment so that we can start to see that flip between the reactive care that we're seeing right now into proactive care. Because if we can start to see that shift, then the results compound. Because at the moment we're spending so much on mopping up the problems from diagnosing too late and dealing with things too late. All of that money can start to be reinvested into proactive care, and then it all starts to work much, much more smoothly.
And what's one myth about women's health you really like to challenge?
I'm going to say the obvious one. It's not niche, because it's not a niche area, and that's a really important myth to tackle, is that it's half the population, but it benefits the whole population if we get it right.
That's right. I always like to end with this because it brings us back to the bigger picture. What does a future where all women are truly seen, heard, and supported in their health look like to you?
A healthy and prosperous future.
That's awesome. Thank you so much, Anna. That's been just amazing. It's been lovely speaking with you. Thank you today for blessing me with your presence.
Thank you so much for the opportunity. It's been great to speak to you as well.